Well, sure. I mean, I can say that Protect Our Care is activated across the country, just with events like these, that hopefully that these Republican senators who might be weighing them are seeing. And I would also just speak to the importance of people making their voices heard and constituents knowing that their voices matter, because many voices are always more powerful than one. I welcome any other thoughts from our panelists who wanted to jump in on that question.
I would ask that Republican lawmaker if they got the COVID vaccine, if their family got the COVID vaccine, and did they know of anyone who had died of COVID prior to the release of the vaccinations, and let them contemplate that.
Let's also remember that I think Trump has nominated somebody else for the number 2 slot who said only 40,000 people were going to die in America, and now we're north of 1 million. And by the way, senators' responsibility is to provide advice and consent to the president, and they need to do their jobs. And what the good news is, if they turn down somebody like RFK Jr., hopefully you'll get somebody better or not as bad.
Also, I would say over 1 million Americans today are living with HIV, and we have some hurdles like 13% of people with HIV not knowing their status and needing to make sure that we have the funds and agencies to reach out and do the proper testing and connection to care. We have ending the epidemic initiative, facing budget cuts by Congress. We have nearly over 500,000 Americans receiving care through the Ryan White Care Act, which provides care and subsidies for underinsured and uninsured Americans living with HIV. And we need an an administration that can, care after those living with HIV, making sure these services are available, continue to be available, and that we're funding initiatives to prevent and end the epidemic. We need someone who's qualified to do that and believes that HIV exists and causes AIDS.
Hmm. And diseases don't discriminate by political party. I guarantee this Republican senator has constituents that are begging for cures, begging for treatments for chronic illnesses and cures for what they and their families are suffering from. And pausing scientific research for 8 years means telling those families, your constituents, sorry, this crackpot is more important than your lives.
And the reason, thank you for saying that. The reason why, I've been living with with HIV for 16 years, and that I didn't die 6 years ago is because of the research that made the life-saving medication that I have today possible. We started with AZT, which was a medication that was so toxic that was actually killing people with HIV, and they were taking, dozens of pills a day, and I'm taking 1 pill a day and have been undetectable living with HIV since 3 months after my diagnosis. And that system of healthcare, of medication, of wraparound services wouldn't be possible with that research and the proper funding in these government agencies and these community-based organizations.
One last point. I don't think we can overlook the overlap between climate change and what is happening to our health, particularly related to infectious diseases. And so it's particularly troubling that we're looking at changes in who would be managing the EPA, as we already hear of 2 potential new pandemics on the horizon.
Thank you all very much. Those